I'm Mr. Shalshi, and today we're going to be talking about cataract surgery. Cataract surgery is the most commonly performed surgical procedure worldwide. As we age, the lens of the eye begins to harden, and surgery is ultimately required to restore vision. Cataract surgery can greatly improve this vision, and patients sometimes no longer need to wear glasses after surgery. So what is cataract surgery? Well, as we said, cataract is the hardening of the eye's natural lens, and it's commonly age-related. The lens of the eye is located directly behind the iris, and is responsible for about a third of the eye's ability to focus, with the cornea or the front window of the eye responsible for the rest of the eye's ability to focus. If the cataract is affecting your vision to the point that it's affecting your ability to do normal household tasks and updating your glasses has not worked, then surgery really is the only option to restore vision. If you don't have the surgery, the vision is likely to get worse over time. During cataract surgery, I make a very small incision at the edge of the cornea and use ultrasound waves or phacoemulsification to break up the lens, and then I remove it with suction. Afterwards, I place an artificial intraocular lens or IOL to replace this lens. The incision is normally self-sealing and we don't need to use stitches. Typically, we only operate on one eye at a time, and so allow the first eye to settle before we do the second. It's all performed under a local anesthetic, so the eye is fully numbed, and you should feel comfortable throughout. The choice of intraocular lens is important as it has a big impact on the quality of vision after surgery, as well as the need for glasses. So is there anything that can be done to prevent cataract? Well, actually, there's no scientifically proven method to prevent the development of cataracts, but there are some lifestyle habits, such as smoking, that can certainly make cataract development more quick. Protecting eyes with good sunglasses from excessive sun exposure, as well as addressing some underlying medical conditions such as diabetes or eye inflammation, can reduce the development of cataract, hence why regular eye examinations are needed. So who is suitable for cataract surgery? Well, any patient with significant cataract that is affecting their activities of daily living is suitable for cataract surgery, particularly when glasses are not improving the vision any longer. There is no upper age limit for surgery, but it is important to take into account your general health as well as the health of the remainder of the eye when performing the surgery to get the best possible outcome. And so many patients ask whether they can have cataract surgery if they have other eye conditions such as age-related macular degeneration. And the answer is absolutely yes, because the vision can be improved despite those other conditions. Actually, in fact, sometimes cataract surgery can improve other eye conditions such as angle closure glaucoma. But it is important that a guarded prognosis is given to the patient, because the cataract may fix some of the vision problem, but the remaining eye conditions may limit the outcome expected from surgery. So how quick is recovery from surgery? Well, generally it's really quite quick. Most patients notice an improvement in their vision within a few days, and full recovery takes about a month. What are the risks of cataract surgery? Well, thankfully, the risks are really very few. Surgery is generally considered to be very safe. The risk of needing further surgery to complete the cataract removal is less than 1%, and the risk of vision loss from things like infection or retinal detachment is less than 1 in 1,000. There may be some vision changes such as floaters in the early months after surgery, but these generally diminish over time. Some patients notice their eye is more dry after cataract surgery, but this can be overcome with regular eye lubricants. And many patients naturally ask whether they will need to wear glasses or contact lenses after surgery. Well, most patients will opt for a monofocal lens and will opt for good distance vision after surgery. In those patients, about 80% will not need to wear glasses for distance after surgery, but all of them will need to wear glasses for reading. There are some newer lenses to reduce the need for glasses. So, lenses called multifocal lenses can reduce the need for reading glasses, but they are associated with glare and halos, particularly when driving at night. Extended depth of focus, or EDOF lenses, are a sort of halfway house. They give patients good distance and intermediate vision, such as for computers or for using tablets. But most of these patients will continue to need to wear reading glasses after surgery. Thankfully, EDOF lenses rarely cause glare and halos when driving at night.